Ontario Premier Doug Ford is denouncing racism against migrant workers while also announcing a new plan he says will help protect them from COVID-19 outbreaks.
Let me tell the people that ever have a racial slur, those vegetables you're eating is because of these migrant workers. Those fruits that you're eating that we can grow in greenhouses because of the migrant workers. And if you don't appreciate the migrant workers, then you go out in the fields and start working your back off when it's 100 degrees out in the middle of the summer. These people are good people. They aren't here to hurt anyone. They're here to help us make a few extra dollars, and I'm just dead against that.
Premier Ford there was laying out a new protocol for farms after 3 foreign workers died from COVID-19 and hundreds of others have contracted the virus. Advocates, though, for migrants have concerns. That's because the new protocol says workers who test positive for COVID-19 but don't show symptoms can continue to work in isolation. Monte McNaughton is Ontario's Minister of Labour, Training and Skills Development. He joins us from Toronto with more. Hi, Minister McNaughton. Good to see you again.
Great to be on your show again, Vashi.
Minister, your government today released a 3-point plan to quell outbreaks among temporary foreign workers. I want to ask you very specifically about the 3rd point in that plan, which indicates there will be new guidelines on allowing asymptomatic workers to continue working. How can you ensure that those workers will be safe doing that?
Well, yes, I was at the press conference today with Premier Ford, where the Chief Medical Officer of Health outlined the new changes, the new public health guideline. I can speak specifically to what we're doing at the Ministry of Labour, Training and Skills Development. I launched a blitz of farm operations back in April. We've done about 250 inspections now, issued 79 orders to improve conditions for these workers. Furthermore, I am glad to say that the federal government has stepped up now to inspect bunkhouses in all of these farms, because the temporary foreign worker programs and the bunkhouses are actually the responsibility of the feds, but we're going to work together to ensure that we just improve conditions for all the migrant workers.
I have a lot of questions about those inspections, but I do want to circle back to my point, because my understanding, I listened to the press conference, I listened to Dr. Williams, and there seemed to be sort of a lack of detail, something along the lines of, okay, if you're asymptomatic, well, you can still work, but it'll be in isolation and you'll live in isolation. My initial thoughts were, well, living in isolation is nearly impossible in these migrant worker communities and specifically on these farms. So how will your government ensure that that is possible?
Well, the Chief Medical Officer of Health developed this new guideline to allow positive asymptomatic workers to work on farms. Of course, they're going to be out in fields, in wide open spaces. They have to ensure that physical distancing takes place and happens, as well as wearing face protection to keep their co-workers safe.
But on the question of living together, I mean, that's where transmission can occur as well. Is your government going to put additional resources, for example, into areas where they can live alone? Are you going to put them up in hotels? Like, how will that work?
Well, absolutely. We've dedicated $15 million, we just announced, for farmers across Ontario that have migrant workers to improve living conditions for those migrant workers, as well as that $15 million is also to help them invest in PPE to keep their workers safe. But as I said, Vashi, it's great news that the federal government now is working in partnership with our inspectors, as well as local public health inspectors, to go out to improve the conditions in these bunkhouses. It is ultimately the responsibility of the federal government.
And we have had the federal minister on a number of times, and I've asked him a number of questions, and I continue to have a number of questions there. But it's your government that's putting in place this policy. And I just have to, the reason I keep asking about it is because I just think we have heard the exact opposite. The public health advice so far has been, if you're asymptomatic and you test positive, if you have even the sniffles, stay home, stay home, stay home. This virus is highly contagious. You know, it almost feels like there's, you know, are you using this as a test sort of to how this might work? Like, I don't understand how you can ensure that these migrant workers will be safe, especially considering there's been outbreaks and 3 of them have already passed away.
Yeah, I feel obviously send my sincere condolences to those 3 families impacted by COVID-19. I can say specifically that when it comes to protecting their these workers and all workers across the province. We're doing everything necessary and to our availability to help all of these workers. Furthermore, we also reiterated again the job protections that we have for these migrant workers and all workers across the province. If they're in self-isolation, if they're in quarantine, they can't be fired for that. These workers are also covered through the WSIB system to give them a compensation if they become ill from COVID on the job. And to the federal government's credit, they have provided a CERB for migrant workers who have made $5,000 in the last 12 months. So again, it's an all-hands-on-deck effort to eradicate COVID-19 from farms and every workplace and the entire province of Ontario.
Will this new guidance apply to anyone working on a farm or anyone who can work in isolation if they're asymptomatic, or is this just specific to migrant workers?
Well, this is specific to those farms where we're seeing the outbreaks right now, specifically with migrant workers. I mean, all of this is based on the advice from the Chief Medical Officer of Health, who explained at the press conference today the reasoning for this and a full detail of why. This is the first of its kind in Canada. That's what the Chief Medical Officer of Health said today.
Yeah, no, I listened to the Chief Medical Officer. I mean, at the end of the day, it's your government that has to either endorse his advice or not. And in this case, you've chosen to endorse it. I just wonder again, so it's okay for migrant workers to work while they're asymptomatic and risk, whatever the risks involved are, but your government is not giving that advice to people who work outside of those communities?
Well, look, it is, as the Chief Medical Officer said today, it's a very unique situation where these workers are working. They're outdoors. I mean, literally, in some cases, thousands of acres of farmland. So they are outdoors. They have to physically distance. That's still the best way to defeat COVID-19. And he also mentioned about the PPE. But I do want to reiterate that we're protecting all of these workers. The laws are in place. The employers have a responsibility. And as I said today, I mean, if these farmers aren't putting the measures in place to protect their workers, the fines are enormous. I mean, up to $1.5 million in fines, including jail time, if they're not stepping up. But we do know that most of the farmers are doing a great job. There's just a couple bad actors that we have to fix.
When you talk about the inspections, I think you said 250, correct me if I'm wrong, 79 orders have been issued as a result of those inspections. Have any of those penalties been levied?
There's been no fines as of today, but there are investigations ongoing. I can tell you with the 79 orders, there are things that have been issued to tell farmers that they have to ensure that their employees, the migrant workers and all agricultural workers understand and know the hazards in the workplace. Farmers also have to let the local public health units know if there is a breakout or if one employee is impacted by COVID-19. So these are some of the things we're seeing through our investigations. And I can tell you we have 500 inspectors out there every single day in the field looking into the situation there and decisively taking action to improve conditions.
And just so that I'm clear, because on the federal side of the inspections, the complaint that we heard from advocates was that they were thus far done virtually. Are your investigations being done in person?
They are being done in person, yes.
Okay, and then I have the same question for you. As I mentioned, I had talked to your federal counterpart a number of times. The first migrant worker in Ontario passed away on April 30th. We've seen a number of outbreaks at dozens of different places. I understand that your government is laying out a plan today to tackle this, but does your government bear some responsibility for not getting to this problem, not addressing this problem soon enough?
Look, this is clearly a global pandemic. We have taken decisive action. I mean, I launched a targeted blitz of not only farms, but also food processing plants back in April. I mean, overall in the province, we've done 12,000 investigations related to COVID-19. We've issued nearly 7,000 orders to improve conditions of all workplaces. And we're going to continue to ensure that workers are protected from this terrible disease. And I do want to make it clear that a worker's passport does not determine how they are treated in the province of Ontario. The full force of the law will be behind the actions that we take.
I take your point on all of that, Minister, but I look to the example of BC, where they took early actions to put migrant workers who had to self-isolate into hotels, and they spent some money on that up front. And as a result, they have a fraction of the number of workers with COVID-19 that Ontario does. Could your government have acted sooner?
Look, there's a number of those scenarios happening in Ontario and have been happening since the beginning of COVID-19. Again, the temporary foreign worker program falls under a federal jurisdiction. We've had a number of discussions, the federal government and us. We are working jointly together with local health units to improve the situation, to ensure that testing is done. We have mobile testing sites or mobile testing units on site. And since Saturday, I know in the Essex County area, 1,000 workers have been tested. We're going to get through this. And we're going to, just continue working together to get to the bottom of this and eradicate that infectious disease.
Okay, I have to leave it there. And Minister, I apologize. I think I misspoke. The first migrant worker died May 30th, not April 30th. My apologies. Thanks very much for making time for us.
Thanks, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.